Hi everyone, Dr. Campbell here, and today we are going to look at Section 3 of our ICD-10 CM guidelines, which relate to other diagnoses. Other diagnoses essentially are all conditions that coexist at the time of admission that can develop subsequently or that impact treatment that is received today, or the length of stay. Two terms that you'll want to be familiar with as it relates to other diagnoses is that of complication and comorbidity. Complications or a comorbidity is defined as a diagnosis that may have an impact on the payment that is received through the payer, in particular, Medicare, for example. A complication is described as an additional diagnosis that ultimately arises after the beginning of the hospital observation and treatment, and by nature of that condition being present, it then modifies the course of the patient's illness or the medical care that is required. A comorbidity, however, is a pre-existing condition. So what that means is the patient walks in the door with it, and because of that condition associated with a particular principal diagnosis, it can cause an increase in the patient's length of stay. So in terms of reporting additional diagnoses, you want to ask yourself if that additional diagnosis falls into one of 5 situations. So does that diagnosis, and this is something that you're thinking about before you actually assign a code for that condition. So just because it's in the record doesn't mean that you can code it. So does it require clinical evaluation? This is something where you would expect to see some type of testing or clinical observations or a consultation that the patient is being clinically evaluated. Therapeutic treatment means something that's done to actually treat the patient's condition. It can be medications, it can be physical therapy, it could be surgery. Those are examples of therapeutic treatment. One of the things that you'll note is that providers often list conditions in the patient's past medical history that are actually currently being treated. As such, coders should be familiar with the medications that you're seeing in the medical record and the disorders that they actually treat. Now, as it relates to a diagnostic procedure, those are going to be for conditions that are that the test is used to determine the underlying cause of the patient's sign or symptom or their complaint. Some types of diagnostic procedures could be a EKG, a EEG, EGD, MRIs, CT scans, just to name a few. The next criteria is, does that condition extend the length of stay? Think about it like the patient is ready to be discharged, but develops a condition that requires more investigation or more monitoring or just waiting to make sure that nothing else unfolds as a result of that condition. And then lastly, the increased nursing care and or monitoring may not need physician treatment. Rather, it requires the nurse or to monitor the patient or do different things. And it's also conditions that just need monitoring. All right, so coding guidelines tells us that diagnoses that relate to an earlier episode have no bearing on the hospital stay. Those we should not code. And so one of the things as a newer coder, you have to just learn by trial and error what's meant by it has no bearing on the hospital stay. The inpatient stay is not impacted by that condition. Of note, these definitions that we're looking at here relate to inpatient settings. So that's hospitals including long-term care, psych, home health, rehab, nursing home, and alike. So a couple of guidelines to take note of, and the first is related to previous conditions. Sometimes our providers are going to include in the diagnostic statement historical diagnosis information or status post procedures that were actually performed on a previous admission. If those conditions do not have any bearing or any impact on the current stay, we don't code them. However, history of codes may be used as secondary diagnoses if that historical condition or even family history has an impact on care or influences treatment. All right, next up, we're going to look at abnormal findings. So as it relates to abnormal findings, we're really looking at codes that fall under the range, for example, R70 through R97. And so those are non-specific abnormal laboratory findings. And it could be the lab, it could be radiology, pathology, or other types of diagnostic test results. Those codes should only be assigned when the provider has not been able to arrive at a related diagnosis, but indicates that the abnormal finding is clinically significant by listing it in the diagnostic statement. Of note, this guideline does differ from how we code as outpatient coders when you are coding a diagnostic test that has already been interpreted by a physician, so a radiologist or a pathologist. Coders should never assign abnormal findings based on the finding itself. That is because the computer is generating a result stating that a value is either higher or lower. A lot of times we'll see L for low or H for high than the normal range. That does not necessarily indicate a disorder. There are many factors that actually influence lab values, and these can include the collection device, the method that's actually used to transport the sample to the lab, calibrating the machine that actually that records the values, as well as the overall condition of the patient. So a great example here, and I think this is worth noting, you can have a patient that is dehydrated and they show an elevated hemoglobin due to the increased viscosity of the blood. When the findings are clearly outside of the normal range and the physician has actually ordered other tests to evaluate the condition or has prescribed treatment without documenting an associated diagnosis, it is now, however, appropriate to query the provider as to whether or not the diagnosis should be added or if the abnormal finding should be listed in the diagnostic statement. Of note, incidental findings on an x-ray, such as a hiatal hernia where the patient's not having any symptoms or a diverticulum, should not be reported unless further evaluation or treatment is carried out. All right, and lastly, uncertain diagnoses. When we are talking about inpatient, uncertain diagnoses, unless otherwise specified, can be coded. All right, guys, thank you so much for listening, and this has been your review of Section 3 of our ICD-10 CM guidelines, which focuses on other diagnoses.